Hi, I'm Frank Diamond, the managing editor of Infection Control Today. We're giving infection preventionists and other healthcare workers battling COVID 19 the information they need. Here's what's happening. In the world, more than 3.6 million cases of COVID 19. In the world, over 257,000 people have died from COVID 19. In the United States, more than 1.2 million confirmed cases. Over 71,000 people have died from COVID 19 in the United States. New York remains the epicenter of COVID 19 in the United States. In New York, there have been over 300,000 confirmed cases and over 25,000 people have died of COVID 19 in New York. These statistics courtesy of Johns Hopkins University. Meanwhile, more than half of America has begun to reopen to get our battered economy rolling again. This even as the death toll keeps rising, and some experts worry that relaxing restrictions too soon might cause even thousands of more deaths. And the science about COVID 19 spread and how lethal it is still being worked out. For instance, a study that has not yet been peer reviewed has gained a lot of attention anyway. In it, researchers with Los Alamos National Laboratory say that they found mutant strains of the virus that causes COVID 19, and those strains are much more contagious and increase the risk that people who had COVID 19 and who have recovered might get it again. Meanwhile, a study in the journal Genetics and Evolution comes to a slightly different conclusion. It too looks at COVID 19 mutations, but says that those mutations are not likely to make the disease any more contagious or lethal. And now Dr. Richard Besser, the former acting head of the CDC, weighs in. Yesterday, Dr. Besser said that enough hasn't been done to protect residents in order to restart the economy. We can't totally reopen until everybody in the country can take the measures necessary to protect their health and the health of their families and the health of their communities. That's Dr. Richard Besser. Coming up, I'll be speaking with Dr. Kevin Cavanaugh, a member of Infection Control Today's editorial advisory board. Dr. Cavanaugh will talk a little about what he says might be the dangers in relaxing social distancing guidelines too quickly. For these and other stories, visit infectioncontroltoday.com. Hi, I'm Frank Diamond, the managing editor of Infection Control Today, and with me today is Dr. Kevin Cavanaugh. He's a member of our editorial advisory board, an outspoken expert about infectious diseases, and he has been keeping an eye on COVID-19 from the beginning. Dr. Cavanaugh, haven't you? So let me play a little devil's advocate with you here. So I'm going to say where I hear sometimes that maybe there's a chance that society overreacted to COVID-19 by shutting everything down. That to use the phrase, the cure might be worse than the disease. What's your reaction to that?
Well, I don't think that's the case. The death toll is continuing to mount, and this is certainly more infectious and has a lethality which is much greater than the common flu. So no, I do not think this is the case at all. And many assume that just because this virus is primarily spread through respiration, that it's just a respiratory virus. But we're learning more and more that it's affecting many other organs in the body. And so people who become severely infected and get hospitalized and have to require ICU care, many times will come off the ventilator or out of the hospital with lasting medical problems which will need treatment. And there's not many people talking about that. So that is indeed a very important problem, and one which is why we really have to pay attention to this disease and try to keep it from spreading. The death toll right now is not dropping nearly as fast as what the experts predicted. They had thought that this was going to peak and at that time then tail and drop off. What we're seeing now in the last few days is that it has peaked, but the deaths are continuing to stay constant. There's also grave concern over underreporting. Just now with Florida, the coroner's records aren't exactly adding up with the state's records. They're off by 10%. The Florida Department of Public Health announced that they're not going to be counting people who are snowbirding, only residents. So if you're from Kentucky and you die of this in Florida, you won't be counted in Florida, you won't be counted in Kentucky. And a lot of elderly individuals do snowbird down in Florida. And there's also many deaths in nursing homes or people who are dying at home that are not being counted. So I have heard figures that the death rates may be 50% higher than what is being currently reported. And that's with social distancing and staying at home. So this is a very dangerous disease. The key to getting our economy going is to make consumers and workers feel safe. And that means we need to get adequate PPE for the workers, consumers to wear masks. And right now, Frank, we do not even have adequate materials and PPE for our healthcare staff.
What about the argument that, well, first off, millions of people are being laid off, they're not being able to pay their bills, they're losing their health care. Again, it circles around to is the cure worse than the disease argument. What about that?
Well, the losing of the health care brings up the argument of should we have a universal healthcare system? Will we ever get control of the epidemic when 10% of the population doesn't have access to the healthcare system on the get-go? And that's not even including the homeless. As far as people going back to their jobs, people are scared to go back to their jobs. And I think unless we can assure safe workplaces and work on that, that will be a big problem. Just because you open up a factory doesn't mean that people will be working in there. And when you say, well, we'll cut off their benefits so that they'll have to work, well, then you're setting the stage for social unrest. Maybe it would be better to concentrate first on getting a safe workplace. And so that's the key. It's not that we've shut down the economy. It's that we cannot open it yet until we get safe workplaces and get at least minimal protection for our workers and our frontline staff. That is of utmost importance.
We're not going to shut down the economy, but COVID-19 is going to be with us for a while. So at what point do you think we'll be able to coexist with it?
Well, I think at the point when people start to change their behaviors, that they maintain social distancing, everyone is wearing a mask, at least a DIY mask, and that we need to also try to get some adequate PPE for people who are working. That's kind of the benchmark of when to open up the economy. It would also be nice to get a vaccine, and those are in the pipeline, and I have great hopes for that. But I don't feel we need to wait for that. But we do need to wait to when we can open up the economy safely, and that is the key.
Anything else you'd like to add about when society gets started, Doctor? I mean, I think people are, I mean, I know you haven't been out, right? And a lot of
Absolutely not. As you know, I had to get dressed for this interview. I've thoroughly got myself at home, safe, and in a comfort zone, if you can be in a comfort zone when you're alone. I know. So, but the main thing is you have to open up in stages. I think in Kentucky, where they're opening up healthcare services first, is a good move. I think that when you look at recreational activities, things that are outdoors in the sun where you can maintain distance, such as golfing, is one that I would do first, as opposed to opening up an inside gym. Restaurants are going to be the hardest because you have to maintain distance. You have people in a closed area, and can the restaurants even turn a profit if they cut down on the amount of tables that are in their establishment? So you do have to open up in stages. But of utmost importance is also the food supply chain. That needs to be opened and opened safely. And so if you talk about first opening up healthcare, then opening up agriculture and food supply, all of a sudden you've got a big chunk of the economy which has to be slowly opened and phased in. Because remember, you just don't have a simple food supply chain. You also have to have distribution. You have to have people around to fix the tractor trailers that are hauling the food. It goes on and on and on, and there is a huge ripple effect to the society that will get up and running. There's some parts of the society, though, I think are going to be changed forever. Whether or not movie theaters will ever reopen, whether or not the middle range box stores will reopen. These types of stores and facilities were already under stress before this epidemic, and people are getting used to doing it a different way. They're getting used to ordering online shopping. Theaters and distributors of movies are now going directly to the internet. It may cost you $20 to watch Trolls for 2 days or rent it, but nevertheless, they made as much money that way as in the theater, and they've cut out the middleman. So this is going to change our economy, not necessarily for the bad, but we are going to be doing things differently when we come out of this. So there's going to be stores and types of businesses that are going to be doing excellent and others which are not. FedEx, UPS, Amazon, any of the telecommunication companies, the tech companies, they're all would be expected to do quite well. And even the big box stores such as Walmart and Target are doing quite well. Walmart stock's trading at an all-time high.
Right.
So, you know, as restaurants are laying off people, Walmart, Kroger, Costco, they are hiring like you can't believe for curbside delivery and delivery to home. So I think you're seeing our society being transformed. And what you have to ask is someone who's now 80 years old, sitting at home, learned how to buy an iPad, order over a Kroger app, get the food directly delivered. Is she going to go back to trying to get out of the home, struggling to go to the store, going down the aisles to search for food and come back to her house? Maybe not. This is actually transforming the type of economy that we're having. So it's not just getting back to the economy that we had, it's whether or not we're going to be opening up with a new economy and start to thrive on that. So I see us more in a transformation and this being transformative rather than being all doom and gloom. I think we're going to come back and do things differently.
And the final question, Doctor, and again, I appreciate you being with us today. Who do you think, what country or what state is doing this, is reacting the best to this, do you think?
This is really difficult to tell. What I do think is that we all need to have a common plan, because the dangers of different states doing different things is because the virus travels geographically so much and our economy is so interrelated that if everybody does their own thing without a good national strategy, nothing may work well. But as you know, we have seen a number of variables, not just on how states are opening or not reopening. You've got population density, you have climate, whether or not you've got a lot of sunshine, heat, and high temperature, and now air pollution is becoming a large factor in the spread of this virus. And then you have different reporting systems in different states giving you different qualities of data. So when you try to report and say, well, who's doing what the best, that's hard to really figure out. The best comparisons I think you can make is between the countries of Finland and Sweden. They have both universal health care. Sweden has a much more open economy. They have not entirely shut down, although they're doing some measures to control spread. And Finland has more shut down. So that when you look at those two countries, one has a much higher death rate than the other has a much better economy. The question is, 12 months from now, will Finland's economy catch up? Will Sweden's death toll rise? Who knows? Maybe Finland's death toll will rise and Sweden's economy will go down. It's really two countries I think that we should be watching. But nevertheless, not having a single national strategy I think is very detrimental. Doing this piecemeal doesn't help the economy, doesn't help the control of the virus. And that's something that I think is pretty distressing.
Dr. Kevin Cavanaugh with us today, Infection Control Today. He's with us every day. He's on our editorial advisory board. Thank you, Doctor, for being with us.
Well, thank you very much, Frank. I appreciate it.